Assalamu alaikum. Today we are going to start from where we left yesterday. It is easy to see most of the busy are busy trying to fulfill more basic needs. That's self-fulfillment most of the time. हमने कल मॉस्लो हायरार्की पढ़ी थी जो साइकोलॉजिस्ट है मॉस्लो उसने ह्यूमन बींग्स की नीड्स का बताया था जिसमें फिजियोलॉजिकल नीड्स थी इक्वलाइजेशन था सेल्फ एस्टीम थी ठीक है ना सेफ्टी थी 5 चीजें उसने डिस्कस की थी We all spend most of our life trying to stay alive and healthy, to be secure, to maintain relationship with our family and friends, and to get some respect and recognition for who we are as a people. Most consumer minds are occupied with their efforts to stay well, get along with the people, and look good while doing so. It takes a lot of time, experience, and maybe even some wisdom just to meet those basic needs. तो मार्केटिंग में जब तक आप बेसिक नीड्स नहीं समझेंगे you will not understand the basic need of your consumer customer. You cannot do a business. So most people do not really get to point where they can pursue self-actualization until they have a few decades behind them. Pursuing this kind of need satisfaction is much more typical of the mature consumer than of the younger people who are still striving for the more basic things in life. Right? The old people, they already fulfill their basic needs, but the youngsters, they are in search of their basic needs. A reference to elderly people who conjure up image in people's mind of the poverty, destitution, loneliness, and ill health. In fact, nothing could be further from the truth. Only a very small fraction of elderly consumer in society fit that stereotype. Yet most people think Yet most people think that way because elderly people in such unfortunate circumstances gets most of the media attention. They certainly deserve our concern, but marketers should not generalize the image to entire group. Means they should take the market elderly people separately, youngsters, women, men, all have got their own needs. We can point out one rather surprising statistic that may help dispel some of the misconception about mature consumer. By the year 2000, more than half of our disposable personal income in this country was in the hand of people over 50 years of age. These are precisely the people more likely to have reached a place in life where they can and do pursue fulfillment of their self-actualization needs. So here, the people in this era in the United States, they were holding the major economy in their hand, the money in their hand, the resources in their hand in 50s, and they are not in search of the basic need, but they are in search of a self-actualization needs means their own, uh, they want to fulfill their own self-actualization. It is also well to note that self-actualization can refer to getting the most out of the life one has even if it is unpaid. With that view, the pharmaceutical industry in the later part of 19 of the 1980s began earnest study of the role of their product in the quality of life of the chronically ill. Indeed, this attribute has become a part of both clinical trial, and promotional themes. Although it is very useful, if not absolutely necessary, to examine the hierarchy of need, we are not confined to only a vertical view. We can look at consumer needs from a cross-sectional point of view as well. From this horizontal perspective, no single category of demand consistently takes precedence over the others. What is more, this approach permits us to identify more categories and to specify them more precisely. Means we have to see the category of the customer in the market, and then we decide to start our marketing. These needs are not classified according to the sequence in which consumer approach them. Instead, that classification is based on the kind of the concern and activities that consumer associated with them. Of course, the youngsters they have got different activities, and the old people they have got different activities, and they require their own product or drugs, medicines. So these categories of needs are more often closely associated with a particular type of consumer product, services, and brand and outlets. So here are some certain consumer needs you can see. For example, achievement, independence, exhibitions, recognitions, dominance, affiliations, nurturance, succulence, sexuality, and stimulations. So you go through this material, you will learn more about the need. Divergence, novelty, understandings, consistency, and security. Demand, demand linked behavior and various models of consumer behavior are available. We we have chosen to use as a frame work and model development by Andrew Toddle. It is simple, but comprehensive and is based on the concept that sickness is a decision-making carrier. Total premise is that illness is an altered state of well-being about which an individual makes a series of decisions. क्या हुआ अभी तो नहीं कर ले as a challenge from the normal occurred, trying to define normal for society is not really necessary for the present discussion. Normal for our purpose and for those of the patient is whether the patient perceives it to be for that reason. Of course, the characteristics of the normal vary from individual to individual. In any case, changes from the normal can take several forms. The most typical one is what we usually call symptoms. For most people, pain is not normal, nor is the constipation, because these symptoms represent a change from the normal. Another kind of a change is altered capacity, for instance, the ability to cut the grass without becoming winded. This kind of change may, of course, be attributed to something other than illness, such as aging. Decision steps in sickness care career change from the normal, no, or yes, then go to change significant, yes, then go help needed, yes, type of help, lay, religion, medical, others, pharmacist, nurse, physicians, others, selection of the treatment agent, and degree and type of the operation. This is one of the models presented by Andrew. Indeed, some such changes should be so attributed, but stereotyping can result in a misdiagnosis. It should be obvious that some people enter the healthcare system without experiencing any change from normal. Many hypertension patients, for example, are diagnosed as ill, even though they are asymptomatic. Such patients begin their sickness career as a result of a routine checkup or screening program. Drug manufacturing cancer's seven danger signals have been described in terms of the deviation from the normality, while some commercial for non-prescription drugs describe or at least imply physical changes that should or should not occur in normal individuals. The role of tolerance should be obvious. Some people certainly bear level of pain that would send other immediate for help. Some variation in response to pain have been also demonstrated. Symptoms are likely to be defined as serious in direct relationship to the unfamiliarity to the patient or to degree to which they seems threatening. Machines have also found mechanics have also found that symptoms which persisted or reoccur tend to be viewed as a serious. Assume about the cause included a component of ambiguity. The seriousness attached to back pain, for example, may differ depending on whether the patient believes it is due to muscle pain or to a kidney disorder. Those skill would make a good case study. The same is true for assumption about prognosis. Some symptoms serious appear to be related directly to the length of the time the symptom is expected to last, the degree of the incapacity, the degree of incapacity expected to be associated with it, and to the degree to which death is thought to be likely outcome. The purpose of all this information is to select your audience, that is your target market, and the consumer or the patient in which. So you must know about each and every aspect of the consumer behavior, consumer circumstances. Interpersonal influence often takes the form of what has been referred to as the lay reference system. That is the network of the friends and relatives who are consulted when a symptom is experienced. These may give advice to the patient. It should be appear that the influence of these significant other is in turn a function of degree to which they are influenced by the personal perception of the factors under discussion. It is well known that many symptoms are experienced routinely by the population, yet many never do anything to relieve these symptoms. Some studies have shown that social stress from other life crises may be a trigger to action. A person who has lived with intermittent bout of stomach pain stimulated by a diverse action suddenly decided to seek medical care. The tractability apparently affects perception of the seriousness. In that condition, perceived as untreatable are likely to take an identity of a disability rather than of the sickness. Physical manifestation visible to the patient and to others are likely to result in attaching great seriousness to symptoms. The same is true for the way a patient handles symptoms, grimaces, and groans by a patient, whether voluntary or involuntary, are likely to lead to a greater level of the severity being attached to the condition have those around him or her. It should be clear from the foregoing that health discussions are complex, subjective, often emotional, and subject to influence by others. Significance among the factors, significance others, among the factors that appear to enter into the patient decision concerning symptoms are the following. Is how patient get advices from the others or how others interfere. Significance others means peers, father, mother, brother, friends. The clarity of the symptom, extent of interference with normal activities or characteristics, the tolerance threshold of the symptomatic person, similarity and seriousness of the symptoms, assumption about the cause, assumption about the prognosis, interpersonal influence, other life crises of the symptomatic persons, assumption about the treatability, physical manifestation, and manage, impression management. By knowing all these background, we have to enter into a new topic which is known as the marketing research. So how we go for the research to find out our market, our customer, and a lot of other things like customer behavior, consumer behavior, or patient behavior, doctor's behavior, paramedical staff behavior, So we have to go for a research for that, and there is a method how to do the research. Marketing research is a systematic design, collection, analysis, and reporting of the data relevant to a specific marketing situation facing an organization. This organization may be selling only the antibiotics or anti-cancer or vitamins or orthopedic medicines, informatics. Companies are using market research in a wide variety of situations. What is the situation? As I mentioned, in the four areas. For example, marketing research gives marketer insight into the consumer motivation. This when you start the research, you come close to the consumer or the patient and see what is the level of the motivation of that consumer or patient, purchase behavior and satisfaction. It can help them to assess market potential and market share or measure the effectiveness of the pricing, product distribution, and promotion activities. And so once you find out the potential of the market and market share, measure the effectiveness of pricing, how your product price affect on market potential and market share, and product itself, what is the product presented to the market, distribution channels, and promotion activities. And large companies have their own research department that work with marketing manager on marketing research projects. In addition, these companies, like their smaller counterparts, frequently hire outside research specialists to consult with management on a specific marketing problem and to conduct marketing research studies. Company itself can do the research, and either they will hire the consultant who do the research and provide the data to the company and their results. Sometimes firms simply purchase data collected by the outside firms to aid in their decision making, and this is known as secondary data. The marketing research process has a 4 steps. Defining the problem, number one, and research objectives, number two, developing the research plan, number three, implementing the research plan, and interpreting the and reporting findings. So this is the process which has got 4 steps for the marketing research: defining the problem, and research objective, developing the research plan, implementing the research plan, and interpreting and reporting the findings. Whatever you find with your research, you have to interpret it in your report. Defining the problem and research objective. So how you define the problem and research objective. Marketing manager and researcher must work together closely to define the problem, agree on the research objectives. This problem definition is consists of 2 types of problem. One problem of the audience, your patient, and one problem of your organization. Do you have the resources to provide those medications or drugs to the patient? Do you have those expertise or skills in your organization to provide to solve the problem? And you have to find out what is the problem of a patient. So this problem is divided into 2 parts: problem of yourself and problem of the patient. The manager best understanding the decision for which Information is needed, where the researcher best understanding marketing research and how to obtain information. So this is very important. So this is the way we are discussing. We have to follow these pattern. The manager best understanding the decision for which information is needed. Of course, without information, manager cannot take a decision. Where the researcher best understanding marketing research and how to obtain the information through primary data, through secondary data, group discussions, through with the help of instrumentation, that is a questionnaires to produce and hand over to the customer, to the patient. Defining the problem research objective is often the hardest step in the research process. The manager may know that something is wrong without knowing the specific causes. So you have to go for the research to find out the causes of the disease. Because without knowing the causes of the disease, you cannot treat the patient or cannot provide a best medication. The first step is probably the most difficult, but also the most important one. It guides the entire research process. It's frustrating and costly to reach the end of an expensive research project only to learn that you have addressed the wrong problem. Means you start your research and finish your research, and then you came to know that you have not identified the right problem, you have identified the wrong problem. Defining the problem and research objective, developing the research plan for collecting information, implementing the research plan, collecting and analyzing the data, and interpreting and reporting the findings. After the problem has been defined carefully, after the problem has been defined carefully, the manager and the researcher must set the research objectives. And what is objectives? Objectives are two types, qualitative and quantitative. What percentage of results do you want? 100%, 80%, 70%, and what will be the quality? A marketing research project might have one of the three types of objectives. The objective of explorating research is to gather primarily information that will help define the problem and suggest hypothesis. Hypothesis means your assumption. If it is right, then it will convert into theory. The objective of descriptive research is to describe things such as the market potential for a product or demographic and attitude of the consumer who buy the product. The objective of casual research is to test hypotheses about cause and effect relationship. How can you find out the cause and effect of relationship? For example, would a 10% decrease in the tuition as a private college result in an enrollment increase sufficient to offset the reduced tuition? Means if you reduce the tuition fees, there will be more admissions. Managers often start with exploratory research and later follow with the descriptive or causal research. The statement of the problem and research objective guide the entire research process. The manager and the researchers should put the statement in writing to certain that they agreed on purpose and expected result of the research. The manager and the researcher should put the statement in writing to be certain that they agreed on the purpose of expected result of the research. Developing the research plan. How you develop the research plan? Once researchers have defined the research problem and objectives, they must determine the exact information needed, develop a plan for gathering it efficiently and persistent, present the plan to the management. The research plan outlines source of existing data and spell out the specific research approach, means how you will enter into the research by survey, by interviews on the street, interviews in supermarket, uh, interview in the hospital, interview at the GP practice, interview at home to the patients or the doctors. Spell out the specific research approach, contact method, how you will contact them on telephone, on internet, person to person, sampling plans, how you will go for sampling, cluster sampling or random sampling, stratified sampling, an instrument that researcher will use to gather the new data. Instrument means questionnaire. You have to develop a questionnaire. For that, the researcher's objective must be translated into specific information need. For example, suppose that Chipotle Mexican Grill want to know how consumers would react to the addition of drive-through services to its restaurant. Means you need an information, specific information, want to know that if the people are coming to your restaurant and if you have started takeaway through drive-through services, how they react. US fast food chain generate an estimated 24% of the sales through drive-through. Means the people come in the car, stop at the front of the window and take the food and then pay and then get away. However, Chipotle, the sustainability-minded fast casual restaurant that position itself on food with integrity, does not offer drive-through the services. And one of the restaurant which is very dignified like PC, Sheraton, they are not starting drive-through services. Adding drive-through might help Chipotle leverage its strong brand position and attract new sales. This new outlet they have opened for the sales. The proposed research might call for the following specific information. Exploratory research. Marketing research to get primarily information that will help define problem and suggest hypothesis. Descriptive research, there are different kind of research or type of research. Descriptive research, marketing research to better describe marketing problem situations of markets such as the market potential for a product for demographic and attitude of the consumer. Casual research, marketing research to test hypothesis. Gathering secondary data, researchers usually start by gathering secondary data. Secondary data means already present that data in the market. The company internal data provides a good starting point. However, the company can also tap into a wide assortment of external information sources. Company can buy secondary data from the outside supplier. For example, Nelson's sells shoppers inside data from a consumer panel of more than 250,000 households in 25 countries worldwide with measures of the trial and repeat purchasing, brand loyalty, and buyers and demographics. Experience amount carries out a full spectrum of consumer studies that provide a comprehensive view of the American consumer, the US economic monitor services. The future company sales information are important social and lifestyle trends. These and other firms supply high quality data to suit a wide variety of marketing information needed. Means you can buy these information or the data from different companies who are involved in such type of data collection research. So these are the different type of research we have discussed and how to collect the data, what kind of data we require using commercial online database. There are also available a database on uh, internet. Marketing research can conduct their own research of secondary data sources, general data services such as the Procost and Lexis. Nexus put an incredible wealth of information at the fingertips of marketing decision makers. Beyond commercial services offering information for a fee, also every industry associated government agencies, business publications, and new media medium offer free information to those anxious enough to find their website or app. Internet search engine can also be a big Google search, for example, be a big help in locating relevant secondary information sources. However, they can also be very frustrating and inefficient. For example, a Chipotle marketer Googling fast food drive-through would come up with more than 6.8 million hits. Still, well-structured, well-designed online search can be a good starting point to any marketing research project. Secondary data can be obtained more quickly and at a lower cost than a primary data. Primary data means survey. Also, secondary data can sometimes provide data an individual company cannot collect on its own. Information that either is not directly available or would be too expensive to collect. For example, it would be too expensive for a consumer product branch such as the Coca-Cola or the Tide to conduct a continuous retail store audit to find out about the market share, prices, and display of its own and competitors' brand. But those marketers can buy store sales and audit data from IRI, which provides data from 34,000 retail stores in market around the nation. So such type of organizations are present and who can provide you a secondary data. Secondary data can also present problems. Researchers can really obtain all the data they need from the secondary source. For example, Chipotle will not find existing information regarding consumer reaction about new drive-through service that it has not yet installed. Even when data can be found, the information might not be very usable. The researchers must evaluate secondary information carefully to make certain it is relevant, fit the researcher's project need, accurate, reliability, collection and reported, current, up to date enough for the current decision, and impartial objectivity collection collected and reported. Primary data collection. Secondary data provides a good starting point for research and often help to define research problem and objectives. In most cases, however, the company must also collect primary data. The designing a plan for primary data collection call for a number of decisions on research approach, contact method, sampling plan, and research instrumentation means questionnaires. Research approach for gathering primary data include observation, survey, and experiments. We discuss each on in turn. Observational research. Observational research involves gathering primary data by observing relevant people action in situations like in supermarket, for example, or in hospital, or in clinic. For example, food retailers, trade journals might evaluate possible new state location by checking traffic patterns, neighborhoods, condition, and the location of competing whole food, fresh market, and other retail chains. Researchers often observe consumer behavior to glean customer insight they cannot obtain by simply asking customer questions. For instance, Fisher Price has established an observation lab in which it can observe the reaction little tots have to new toys. Fisher Price Play Lab is a sunny toy strewn space where lucky kids get to test Fisher Price prototype under the watchful eyes of the designers who hope to learn what will get them worked up into a new toy frenzy. In the lab, some 3,500 kids participate each year testing 1,200 products annually. Our designers watch and learn from how children play. Say a Fisher Price child research manager. It really helps us make better product. So you have observed that how when you do the research, there are certain examples I have given you. And these examples are very important, and you must remember these examples also. How to start your research and how to solve to find out the problem of your customer and your own problem. Marketer not only observe what consumer do, but also observe what consumer are saying. As discussed earlier, marketer now routinely listen in on consumer conservation in blog, social media, and websites. Observing such naturally occurring feedback can help insight input that simply cannot be gained through more structured and formal research approach. A wide range of companies now use ethnographic Ethnographic research involves sending observer to watch and interact with consumer in their natural environment. The observer might be trained anthropologist and psychologist or company research and managers. For example, food insight team frequently bar and other locations in a top secret small town location. They call it the outpost without a day drive of Chicago. The researchers use the town as a real life lab, hobnobbing anonymously with bar patrons, supermarket, restaurants, diners, convenience store kids, clerks, other town people to gain authentic insight into how middle American consumers buy, drink, dine, and social around food and competing beer brands. So this is also the way observation to observe and put yourself in that society or in community and observe their attitude, behavior, lifestyle. Global branding. Landor launched Landor Families, an ongoing and ethnographic studies that have followed 11 French families intensively for the past 7 years. Landor research visit the families twice a year in their home, divide deeply into both their refrigerators and their food shopping behavior options. The researchers also shop with the females families at the local supermarkets and look over their shoulder while they shop online. The families furnished monthly online report detailing their shopping behavior and options. The landlord families study provides rich behavioral insight for the landlord client, such as Danone, Kraft Foods, and Procter& Gamble. Today, big data analysis can provide important insight into the what, when, and where of the consumer buying. Here is a table which is giving you some information, planning primary data collection, how you collect, research approach, contact method, sampling plan, and research estimate means questionnaires, observation server and survey and experience, observation contact method, research approach is observation, survey and experience, contact method mail, telephone, personal, online, sampling method, sampling unit, sampling size, sampling procedure, research questionnaire and mechanical instrument. This is all about for today. Now we are going to discuss in next week rest of the topic.